Hi, everybody. It's Catherine here, and I wanted to come on and say that I am done with day 14 of my second round of 5-fluorouracil. I am so happy with the results. I am just beyond. I'm so happy. For any of you that have been watching me, or for those of you that this is your first video, please go back and look at my day 21 done video, which is at Catherine's Life Over 50. And the reason I say that is you are going to see exactly how effective this medication is for precancerous cells. It's amazing. It's amazing. So anyhow, I'm going to zoom in and just kind of give you a close-up of some of the reactions that I've had and what I'm going to do about them. So we'll start with right here. This is kind of a chapping from my eyeglasses or my reading glasses sitting on my face with the 5-fluorouracil cream. It concentrates it and it does give a little bit more of a chapped look. So that is of absolutely no concern. But zooming into my forehead, I utterly had zero eruptions. My eyebrows, which have always been a huge concern, had a light reaction, but no eruptions whatsoever. So I'm absolutely thrilled with that. My temples, I had no eruptions, no reactions at all. I do have, and I can't even see them on the camera, so I can't really point them out correctly, but I do have a light spot, reddish spot somewhere in here, and a little bit here, and then there's a little red spot somewhere in here. I am going to continue to spot treat those until I hit day 21. As far as my nose, no reactions. This right here is a little chapping because wherever it concentrates, it does chap a little bit. I do have a little bit of a red spot here, which I also had last year. It's much lighter this year, but I am going to continue to treat that until day 21. No reaction here. This again is chapping. And then coming down along my Mohs surgery, nothing. This right here is also chapping from the 5-fluorouracil drip, what am I trying to say here? Drifting. It just kind of follows channels and kind of drifts and whatever. So these are not reactions in the sense of skin cancers. They are just reactions from excess cream. This side of my nose right here, I do have a little bit of redness somewhere in here. I am going to continue to treat that until day 21, solely because that's what got me here with skin cancer. So I'll continue to treat that until day 21, but I had nothing, no reactions at all. I just can't even believe it. And I did end up going ahead and treating this area right here because it had lit up so quickly the last time. I thought, you know what, just see. And it did not. So I'm very happy with that. And this is something the dermatologist is watching, but says that it's some sort of a blood vessel. So there is a good look at my skin after 14 days, second round, 5-fluorouracil. Amazing. I'm so happy. So anyhow, what would I like to tell you? I'd like to tell you, if you're on the fence about doing this, go back and look at that day 21 done video. It will show you it's not a cure-all. I still have precancerous cells in there. Your cells are always turning over. I will have to do this again on my face in the future, but for those of you that have been dealing with getting all the freezes on your face every time you go in, that kind of thing, talk to your doctor about this cream. It's not fun, it's not easy, but it is effective. And this is absolute proof that it is effective. Am I saying that you're going to do a second round and you're not going to have eruptions and that your skin is going to look smooth and you're going to have a few spots that you have to deal with? No. Yours could be, you could have more precancerous cells that are, coming up to the surface and needing to be treated. But why wouldn't you want to take this route and eliminate the possibility of having a serious surgery on your face? A big hole in your head, a big chunk of skin that they have to attach to your forehead to bring blood flow to the new tissue that they've had to attach to your nose, or a big thick, what I called bacon, that had to be attached to my face in order to recreate a nostril, and tissue being taken out of my ear to do that. I just don't know why you wouldn't at least consider it. And that's why you have a dermatologist. Talk to them. It's so, I'm just looking at myself in the camera right now and I'm just amazed. And when I keep going back to that day 21 video, looking at different areas, it's effective. It is. It's effective. That's all I can say. So, for those of you that are in your winter season right now, you could probably still sneak this in until early April, only because they do say it's easier on you to do it in the winter months when the days are shorter, the air is cooler. It can be done in the summer. It is more uncomfortable, but it can be done. Or maybe you get a treatment plan in place now and you wait until next winter to start, but at least have a plan. There's just no reason to not at least give some part of your face a try with this. You can do it in quadrants. Make a treatment plan with your doctor. Hey, I'm front facing. I can't have my whole face, inflamed. Do a quarter of your forehead, do, the lower half of your face. Whatever you can do to get these precancers under control before they turn into something that is not treatable, but only by surgical excision. I don't want that for anybody. It was a miserable experience. Miserable. It was horrendously expensive. It's just not necessary if you can catch it early. So those would be my words of encouragement. Get a treatment plan in place. Talk to your doctor, get a treatment plan in place. Even if you can only start with your nose, then that's what you do. It's just so frustrating to me, just solely because had I known about this cream 20 years ago, I probably would have never had to have this. It just makes me so angry. But the other thing too is you can treat your hands, you can treat your arms, you can treat your legs. If you're, wherever you're having your chest, you can do your chest. A lot of women in their décolleté, men from, playing tennis with no shirts or maybe fishing or whatever it is that you've been doing outdoors where your skin has been exposed. It is a treatment. And they can outline a plan for you, and you can do sections. You don't have to do your whole body at one time. It's not necessary. But do the worst areas that you can possibly get done sooner versus later. But that being said, I have very much appreciated you following me through this. And I am so happy to be able to show you these results. I just keep going back and looking at my day 21 going, oh my God. So anyhow, that being said, I will see you again soon. That will be a video about my skin cancer journey. And while not exciting, it's probably very relatable. And the only other thing that I would ask is if you could like, share, and subscribe, not for monetary compensation on my part, so that other people get caught in the algorithm and maybe see one of these videos that could really, really help them. And I really appreciate you, and I wish you good skin health. Wear your sunblock, wear your hats, wear your clothes that cover your arms and your legs, and go out at the right times of day, not between 10 and 3. Be an early person, be a late person, just don't be that in between person. Really stop sunbathing, stop going out and doing the tanning booths. So bad for your skin. We just have so many protective measures now that there's no reason, that anybody has to suffer like this. So, and if you have any concerns, if you're not sure, that's why you have a dermatologist. Go in with a list, so you don't forget anything. That's how they found my squamous cell. It was just me saying something after my exam, and then they took a second look at it, and I will explain that in that video. But you have to advocate for yourself. Advocate for yourself so that you can get on top of this before it becomes untreatable. So thank you so much, and I'll look forward to seeing you again. Take care. Bye-bye.